based medicine which can treat and cure the brain stroke. Brain stroke happens when you have a clot in the brain or sometimes hemorrhage, about which my colleagues also will speak. So there are some risk factors for stroke. Who will get it? And that's also one of my colleagues will speak. But when you get a brain stroke, either there is a blood clot in the brain, which we can treat with blood thinners, or there is a hemorrhage in the brain because of the rupture of the blood vessels. Both can be treated now very, very efficiently, and there are good medicines. They are called blood thinners or clot busters, and there are some surgeries which can save the patient, and there are some interventions where you can go into the brain and then bring out the clot. So there is so many good treatments. However, you have to reach in time. If you come within 4.5 hours, you can get the injection. If you come within 6 hours, you can get the brain treatment. So it is time bound. Time is brain. Remember this one. If you have any brain stroke symptoms, please act in time to save the brain. This is our message. Now I will request our treasurer to tell about the risk factors, who will get it, why they are getting it.
Yeah. So as ma'am has already told about the treatment and about all those things. So the question comes, can stroke be prevented? What are the risk factors which we need to take care of, like when patient can have a stroke? So the number one is hypertension, blood pressure, BP. Number two is diabetes, sugar. Number three is cholesterol levels, high cholesterol levels. Number four is all our junk food and all those things like fatty foods, high cholesterol foods. Number five is sedentary lifestyle. Like nowadays, many people are having a sedentary lifestyle. Go to the work, go sit in the office, come back, eat, sleep, or drink. Then alcohol, smoking, drugs. So all these are the major risk factors which we need to take care to prevent a stroke. Also, if there is always a question which attendants and patients ask, डॉक्टर साहब हमारे मरीज को एक बार अधरंग हो चुका है, क्या इसको दोबारा हो सकता है, क्या उसके क्या चांसेस और हमें क्या प्रिवेंट करना चाहिए, क्या ध्यान रखना चाहिए. सो सेम थिंग्स अगेन, हाइपरटेंशन, डायबिटीज, स्मोकिंग, अल्कोहल, एक्सरसाइज, brisk walking, all these factors have to be taken care to prevent a primary stroke and to prevent a secondary stroke. Blood pressure control is very important. Many people say, डॉक्टर साहब दवाई लग जाएगी, सारी उम्र दवाई खानी पड़ेगी. But in having just a one tablet can save your brain, can save your heart, can save your kidneys, can save your eyes. Similarly, controlling diabetes is very important. Very common thing, how much sugar level should be, fasting should be less than 110 and post prandial खाने के 2 घंटे बाद की शुगर 180 से नीचे होनी चाहिए. उसी तरह बीपी भी 135/85 मिलीमीटर ऑफ मर्क्यूरी के आसपास आपको ये चीज़ें मेंटेन करनी है. सो taking care of all these risk factors, you can prevent a stroke.
So I will now request Dr. Rishi to tell him.
Pay my thanks to ISA, Indian Stroke Association, which has reached our town Jammu. This is not a small thing, and because this will encourage the people of Jammu to come forward for the treatment. I thank P. Vijay ma'am, who is the president of Indian Stroke Association, to visit this place for the very first time and teach us about the stroke. So, madam has already told, Dr. Slil has told about the stroke. I just want to tell, once a patient comes with a stroke before 95, as madam said, there were no concrete treatments. There were only antiplatelets, a few drugs to take care of secondary prevention. But with time, now, if a patient is able to reach a hospital, a center where we can treat stroke, we can reverse his neurodeficit. Like the madam told, the be fast. So we can make there are few drugs, if we inject them in the proper time, within 5 hours, 4 hours, there are some time frames, the patient, we can cure the patient. His balance can be okay, he can see properly, he can speak properly, his whole life changes. So the treatments available these days are intravenous thrombolysis. It is a small injection, right? It just takes 2 minutes to give that injection. We have injections which are given 1 hour as well. So if a patient is well within time, we will give the treatment as IV thrombolysis. It has changed the scenario of stroke for last few years.